Lyme disease is diagnosed by a combination of features. The most important starting point, of course, is what the patient's experiencing, the symptoms of Lyme disease. Unfortunately, the symptoms such as fatigue and fever and achiness are common symptoms in many illnesses. So by themselves, the symptoms cannot be used to diagnose Lyme disease. A little more reliable than symptoms are what are called signs of the disease. These are more reliable because they're more unique to Lyme disease. For instance, the rash, that round red lesion, is fairly unique and is fairly specific for Lyme disease. So sometimes we can make a diagnosis based on the rash if it's present, but the rash isn't always present. If we see the rash and discover it, then that can actually be diagnostic by itself. In the later stages of Lyme disease, there are also signs that you can see. Facial palsy in the second stage, swollen knees in the third stage. And those signs are somewhat specific for Lyme disease, but not absolutely. There are other causes of Bell's palsy, there's other causes of swollen knees. And so in those later stages, that second and third stage, the diagnosis needs to be confirmed by a blood test, which is called a serology blood test. This blood test measures the antibodies that are formed by your own immune system in response to the Lyme disease bacterial infection. So these antibodies are measured using what's called an ELISA test, and if the ELISA test is positive, it's confirmed by what's called a Western blot test. So this ELISA-Western blot combination is called the two-tier testing strategy. It is helpful for second and third stages of Lyme disease, but not helpful for first stage Lyme disease. The reason for that is because it's an antibody test, and antibodies take weeks to develop. And so at the initial presentation of Lyme disease in the first stage, those antibody tests may be falsely negative because the immune system hasn't had enough time to produce the antibodies. Because of that, if the physician is still suspicious of Lyme disease and they can't make the diagnosis by the rash, then the antibody test in that first stage can be done, but should be repeated 3 to 4 weeks later to make sure that we haven't missed a diagnosis with a false negative test in the first few weeks. What we would like to see in the future are tests that directly measure the infection. These would be tests like a culture or a PCR test or an antigen detection test. Those are the kind of tests that we rely on in infectious diseases for other infections like HIV or hepatitis C or strep. There we're actually looking at a direct test that measures the presence of the bacteria, and those are obviously much more reliable than a test that's looking for indirect measurement of antibodies, which don't represent the actual infection. The antibodies represent the immune response to the infection. So a very important difference between direct tests, which are not generally available for Lyme disease, and a serology test, which measure immunologic recognition and immunologic memory. At the Johns Hopkins Lyme Disease Research Center, we're actually looking at new ways to develop direct diagnostic tests, such as PCR tests that would directly identify the bacteria Borrelia burgdorferi and wouldn't rely on the older serologic tests. Since Lyme disease is a tick-borne infection, the seasonality of the disease is linked tightly to the behavior of ticks. Nymph stage or adolescent ticks feed in the late spring and early summer, and they transmit most of Lyme disease because they're very small, about the size of a poppy seed. Very difficult for patients to see or feel. And because of this nymph stage tick feeding pattern, most of Lyme disease is actually transmitted in the late spring and early summer. Probably 80+% of the cases are transmitted. So we know that there's a high seasonality and that May, June, and July are the big risk months for acquiring first stage Lyme disease. Now, adult stage ticks feed in the fall and winter, and so there is some transmission of Lyme disease in the fall and winter and throughout the year, but that's a small percentage of cases. The vast majority are transmitted in May, June, July, and early August. That's the reason that we have to be especially vigilant for unusual symptoms in the early summer months, especially that early summer flu-like illness that is not typical, that lacks typical viral symptoms like runny nose or prominent cough or prominent diarrhea. In the absence of those typical viral symptoms, that summer viral-like illness may actually be Lyme disease.